Let's turn our attention back to that little boy pictured lying on the floor of a hospital in Leeds General Infirmary. It happened on the night of December the 3rd. His mother took the photograph after she took her little boy, Jack Williment-Barr, just aged 4, into hospital with suspected pneumonia. She then took a photograph of him as he lay on a pile of coats with just a jacket over him, breathing through an oxygen mask, and she sent it to the Mirror newspaper. It's been all over the news, and of course it was a photograph that was shown to the Prime Minister, Boris Johnson, yesterday. He ended up refusing to look at it and taking the reporter's phone in a rather bizarre interview. But let's talk about all of that now with Niall Dickson, who's Chief Executive of the NHS Confederation. Good morning to you, Neil.
Good morning.
It's a very worrying sign that anybody would be lying on a floor in the hospital, let alone a young child, let alone one that has suspected pneumonia. We know that the Chief Executive of Leeds General Infirmary has apologised to the family of this child, saying that actually it was a very busy week and that they didn't have enough beds and that they had been put into a little ward area without a bed. Do you know yet what actually happened and why this child was treated in this way?
Not in the specific, and I wouldn't comment on the specific case in that sense. What I think the photo of Jack shows is something that I think is quite rare, but is completely unacceptable. And although it's rare, what it does do, I think, is illustrate just the huge pressures that the NHS is experiencing, that staff are experiencing on a day-to-day basis. That's certainly not rare. There are millions of patients being treated successfully, but it is a huge service, and there are places where at various times the level of care that people are being offered is not good enough. And in this case, I think it even went beyond that to a level which I think the hospital has acknowledged that it simply wasn't acceptable. But it's not an absolute one-off. Because of the huge pressures that we're seeing in emergency departments up and down the country, there will be examples where people are left far too long waiting for care as staff desperately try and cope with the huge increases in demand that they're experiencing.
Isn't one of the key issues, of course, is we've got a lot of this horrible phrase, isn't it, bed blocking, and I've had an elderly relative who wasn't able to leave hospital, and I know exactly, and moving from ward to ward, I know exactly what's been going on at first hand, that there are an awful lot of elderly people, there isn't care for them elsewhere, they end up staying in hospital, those wards get full, the wards that feed them get full, nowhere to take people from A&E, because there's literally nowhere for them to go. So it's a question of sort of feed through from A&E. If someone could be being treated, they just simply haven't got anywhere to go after that treatment. And in which case, is this all about money? Is this all about the number of beds? Is it all about the number of staff? In which case, does throwing a few more £1 billion at this, does that solve the issue? Or is there something else that's also going wrong?
Well, I think you're right. There's something more fundamental. But let's be clear. We focus in on the emergency department where, terrible things occasionally happen, and certainly there are large numbers of people who are not being treated as quickly as the service would like. But the reality is the reason why hospitals are experiencing this huge pressure at both ends, as it were, both in terms of getting people out and in terms of people coming in the door, is because we haven't, and this is not just this government, it's a long-standing thing, we've not invested sufficiently in social care and in the community where we could help to alleviate some of the pressures by treating people earlier, by giving them better joined-up care and managing people in their own homes. And the service is not geared up to do that. There are plans, absolute plans to take that forward, and that's frankly where all the parties do agree, although they won't.
Are there absolute plans? Boris Johnson said when he arrived in number 10 after the Tory leadership contest that they had a plan for social care. It's not in their manifesto. No sight or sound of it.
No, you're right on social care. I meant in the NHS terms. There is a long-term plan for the NHS, but you're right. The missing element of that long-term plan is a series of promises by the current administration that they will tackle social care. Now, it's true that some of the other parties have actually come up rather last-minute-ish, but they have come up with proposals for social care, and there's certainly a commitment on the part of the Conservatives. But frankly, we've seen promises around social care from successive governments for a long period of time, and really we have run out of road here in terms of social care.
But again, a lot of that is about money, though, isn't it? And social care funding comes from central government funding to local councils. It's not joined up with NHS care, which comes directly from central government, and it's very expensive, and there's less and less of it about. And if an elderly lady or gentleman can't be released from hospital because they haven't got care at home, then they can't be released from hospital. And then we've got a huge cost in hospital, haven't we? Compared with, although still a high cost, nothing like the same level of cost in social care.
I think that's absolutely right. So the reason why successive governments have failed to tackle social care is it's not been pushed to them with the force that it needs to be pushed, and when they do look at it, they go, oh my goodness, it's going to cost an awful lot of money, and then duck the issue. So I think we've reached the end of the road as far as that's concerned. The other issue, and you did touch on this, it's not just about money, it's also about a workforce and trying to get the workforce in place. And traditionally, we've not trained enough people in this country. We've relied on overseas recruitment. We are seeing huge pressures at the moment. We've got something like 100,000 vacancies in the NHS in England. That will not be solved overnight, even with money. So there is that issue. And the third one is exactly what you touched on, which is the way in which we organise our services at the moment is basically it's not integrated, it's not all joined up. And if we could develop a more joined up thing, which will take some years to do, then we may have a chance of managing this huge demand, which you will get as we get something like an 8% increase year after year in the number of people who've got a number of different long-term conditions, a product of our success in the health service.
Now, we talk a lot about winter crises in politics in terms of the NHS, and one of the fears that a lot of politicians had about going to an election on the 12th of December was that there would be a winter crisis, but we're told repeatedly by people in the NHS that there was a summer crisis this year, as actually crisis is now an all-round state of affairs for the NHS, but we've also seen the norovirus, the vomiting bug, has been taking up a lot of beds, closing wards, but also that the flu strain is actually particularly virulent this year and is starting much earlier, a couple of weeks earlier than would be expected. Should we be bracing ourselves for a full-on NHS winter crisis this year?
I think we should, because certainly that we surveyed our members, so leaders of the NHS in England who are actually providing frontline services, and certainly nearly 60% of them thought that this would be the worst winter on record. And it's that combination of factors. First of all, just continuing increase in demand. Some of that is because of the fragility of social care and primary care, but there are other things like demography which is causing that. And then you've got those factors you referred to. Norovirus arriving, again, that means shut wards and all the rest. You've got problems of flu starting to happen. And the other issue is always weather. If the weather goes really bad, then again, you can either get trips and falls and all that kind of side of things, but you can also get very vulnerable people who end up in emergency department because of the cold. So I think we have to brace ourselves, and I know that the service is bracing itself. An awful lot of preparation has gone into this, but the reality is that the troops that we've got in order to try and fight this war, are really strained and are going to be strained over the next few weeks and months. Okay, thank you so much for joining us, Niall Dickson, who's Chief Executive of the NHS Confederation, for people who represent the actual NHS Trust bosses, the people actually doing the management.